Good morning to everybody, and I am so thankful to have been asked to be able to make this presentation. This is a labor of love for many of us who are doing this work, and it is definitely something that I believe, as I tell my staff all the time, I count it joy that we get a chance to do this work. One, because we know that the people that we are supporting are in need of it. I worked in the jail 2017, 2018, and is when I really realized what was missing because at that time they did not have the opportunity to have anyone support them. So this has been a really good tool to be able to move positive birthing outcomes as well as support in an incarcerated space, and not just for the incarcerated, but for all who are justice impacted. Again, I am the doula coordinator for AIM, Care First Community Investment Doula Program. We started in 20, the bill passed for this, I'm going to switch to something else. The bill passed for this um, program in, I believe, 2018 or 19. I can't remember the exact dates. And in 2020, 21, the Assembly bill was actually passed so that we could, which is Assembly Bill 732, which we were able to be able to better support those who are incarcerated with prenatal and postpartum care, to support persons that support those persons that are birthing, that are incarcerated during that time, to give them access to community programs. The more important one part of this bill was that they're not allowed to be tased or pepper sprayed or shackled. And those things we know happen, and they are still, unfortunately, they are still happening, but not as often as they were. They're allowed free tampons and pads, and the language from prisoner or inmate has been changed to incarcerated birthing person. And that is to give who they are dignity, opposed to um, reminding them of the fact that they are incarcerated. They know that. They see it every day. They get up and they know they have to get up at 5 o'clock in the morning. They know that they have certain times that they do everything. Everything is timed and everything is a way in which the sheriff's department or whoever the law enforcement agency is, you do what they're telling you to do. So you have no rights. And in some cases, we have been faced with, when we're working in this space, with somewhat being told that they shouldn't have the ability to have doulas. So that's also been something that is a real difficult aspect. Next slide, please. And can you go back to, I think, the second slide? So I want to share who my staff is. As you see, I have a team of 4 doulas, and they provide services for the incarcerated. Luz, Tika, Lynette Cloud are the doulas that are concentrated in that area. They work with the incarcerated individuals specifically. Yadira works with DPS as well as CFCI, as she works with those who are reentry persons opposed to actually going to the jail. And then we have Michelle, who is our backup doula. And right now, Michelle is basically serving most of our postpartum clients, because we do get postpartum clients who've been arrested. And when they unfortunately come in, they still need support. And I know that, people don't really understand what that looks like. So she provides what they need after the baby comes, making sure that if they are attempting to want to continue to feed their baby breast milk, or the things that they are in need of, Michelle is that person. And I'm so thankful that she is that person. Can we go to the fourth slide? So Care First Community Investment, CFCI, is our funder, and it is been able to expand through LA County Executive Offices for the funding. A percentage of the county's budget is allocated to said programs, and they are mostly those that are justice impacted those that are in need of housing, those who are in need of um, uh, providing job skills. So this particular funding goes specifically to justice and um, systems impacted individuals. And the goal of the program is to improve the birth outcomes, to reduce the stress, and to ensure that no one, like I like to say it, here says here delivers alone, but no one births alone. The doula services are offered to the pregnant persons that are in custody and those that are released from CRDF, which is Century Regional Detention Facility. We also don't just put it in that category for just those individuals, those who are homeless, those who are drug addicted, anyone who has issues with what is going on in their lives. We want to make sure that we try and provide doula services if they're needed. Next slide, please. So we serve in two categories. One, we serve at CRDF, and we provide services through the hospitals so that we can support those that sometimes come in and are not incarcerated but are in need of support because they don't have any. And when we can, we try to do that. When we work at CRDF, that we're in partnership with the medical providers, mental health clinicians, and custody. And this program, in the way we provide our clients, we make sure that we first work with them, talk with them about who we are and what we do so that they'll consent and be enrolled in the program. And of course, documentation is definitely required. We encourage self-efficacy as well as self-advocacy. We want to make sure that the doulas are supporting the clients with childbirth education, mental health screening, preparing for separation, which is really a hard thing for them, nutritional guidance, and that's not always the best nutrition, but we try to help them understand what is good for them to, if it's provided, to eat, and other related needs that they may have. If the identity, I'm sorry, we identified the client request and additional birth support persons, and that is to ensure that there is someone that is with them at all times when labor begins. And that happens when the nurses say that labor begins. We've had issues from time to time of being asked to leave because unfortunately the staff don't always know what that, as far as custody staff doesn't always understand what that means. So we also provide continuous support once they're released, and we make sure that they are referred to program. And we also have doulas on site 5 days a week. So there's always somebody there to make sure that if there are questions, they can answer them. And we also now provide lactation support. And that means we have an IBCLC to come in. We also ship milk to families if those persons' families are not in position to come to the jail to pick up that milk for them. So we want to make sure that we are covering every base that we need to support them in this endeavor. When the doula is going to the hospital, we first actually have to be called to be able to come to support them. And sometimes that's missed. Not always. It was in the beginning. We had issues with it, but it is not as much. Sometimes it can be a little difficult. They provide the emotional and physical educational support that the client will need during labor and delivery. And this does involve, from time to time, physical touch, closeness, and bringing comfort into that space as we are permitted to do so. Sometimes it can be a little challenging, but most of the time we have not had anyone to object to the touching, to making sure the massages happen, making sure we are able to provide all the care that we know that they deserve. We serve as care team members, ensuring that the client is comfortable with the knowledge about the decisions that are made. We, of course, are not those that advocate for them. We show them how to advocate and show their families how to advocate. And then postpartum support, we ensure that the client receives continued support after delivery. and they are seen by the IBCLC lactation consultant, as well as the consultant that is at the hospital. And we also make sure that the doula is present when the separation happens, because we find that that is probably one of the most difficult times after the birth has happened for that mom. Next slide, please.
And it looks like there's a question already in the chat around do folks deliver at only one hospital? So I wonder if you wanted to elaborate on that at all.
We so we primarily work with LA General. However, when they opt not to, and I know this is gonna be an issue for some, and because this was an issue for me in the beginning. A lot of our clients that we serve in that space actually are induced for various reasons, for family support, for the fact of making sure that there is not any issues with the baby being born, coming at a time where it could be actually born in the cell. And sometimes they're not notified, or no one's notified, and there becomes issues with that. So we try to make sure, the staff tries to make sure that we talk to them about what that looks like. And we know that it is not always a comfortable space for those of us who are doulas who are doing this work, because we know what induction can cause. So, but we also know that some of the hospitals, unfortunately, in the area are not the hospitals that are supportive. There are two hospitals outside of um, LA General that are in that community that from time to time they are sent to. So they don't always birth at LA General, but that is the hospital where primarily the births happen. And they happen there because usually they're scheduled. The inductions are scheduled, or even sometimes they might say that they're feeling like, that they're having contractions. And if their contractions are far enough apart, then they will transport them to LA General. And that's to avoid some of the spaces that we go in, um, because we have been met with in one particular hospital where they are not welcomed and they are treated very poorly. So, we don't advocate for inductions, but we do talk to them about what that looks like and why.
Thank you, Ms. Toy. And we have, actually, I wanted to name this at the start, but I'll just name it now, that we have folks that represent our local jail, our sheriff's department, as
Okay.
well as a hospital where pretty much all of the pregnant folks go to deliver. So I
Okay.
wanted to just name that.
Okay. My question about that is, is that the hospital that is designated? Has there ever been a time that they go to other hospitals outside of that one, or is it just that one?
I think the only time, so I work at Arrowhead Regional Medical Center, which is the county hospital, and we care for the incarcerated patients, and
Hmm.
our OB clinic also does their prenatal care.
Okay.
Um, so I think the only time I could think that they would go to another hospital is if it was emergent, like a precipitous
Mm.
delivery, and they were just going to a closer hospital, because there's at least one hospital in between us and the detention center on the
Okay.
freeway. So,
Okay.
but we do care for, I would say, the vast majority of them.
Okay. And since you say that, I will also note that CRDF has a clinic, an OB clinic, so they are cared for at the jail, at CRDF, unless they are high risk, and then they are sent to LA General for their care.
Trees, can I just ask too, just from what Toy was saying, do you find that a lot of our moms in San Bernardino County also have induction, or do they, is there a decent amount of people that have spontaneous, start of labor?
I would guess that it's similar probably to the general population.
Mm.
I mean, we just do a lot of inductions,
Right. Yeah.
and we do have a lot of medical reasons for inductions,
Yeah.
and a higher risk population. So I don't really think it would probably be too much different than the general population, but I
Hmm.
wouldn't have a number for you. That's just
Sure.
my
Yeah.
my guess.
Mhm.
Mhm.
Yeah.
Mm.
Something that another organization, we had the Michigan Doula Project come and do a presentation sometime last year, and they were noting that a lot of the women in their doula jail program opted for cesareans at times because which is odd, sort of like the idea of opting into that, right? Like theoretically, it's supposed to be medically necessary, but
Right.
because they can have a longer stay with their baby. And so I'm just curious if that has ever come up for you, Toy, and Teresa, you could mention as well we've in our county talked, it doesn't seem like that has been like the strategy for the moms, but I don't know, Ms. Toy, if that comes up for you.
It has come up, but the doctor that we work with doesn't embrace it. So,
Good.
it has come up. I will say this, the staff that works in our OB clinic are really great individuals who support, the rights of the people that they're working with and serving. So they're not in favor of, I want a cesarean because I can spend more time. I will say this, at LA General, it is definitely a place where those that are working with the incarcerated population have a serious understanding of how important it is for them to have the time with their baby. So it is not always rushed. They usually have anywhere from, if they have vaginal births, they usually try and give them 3 to 4 days before they are sent back home. And a lot of that is so that they can spend time with the baby. So they make sure that they're connecting and have that connection at least. And I think that conversations sometimes are had with the birthing families so that they will push it out as far as they can to do pickup. And even working with DCFS sometimes make sure that they get a little bit more time. So they do get a little bit more time. And there was a bill I know that was, if I'm not mistaken,
It's
that bill was passed.
Yeah, AB 2740 to
Yeah,
extend the time.
but
Yeah.
it hasn't, the bill
Gone into
hasn't,
effect.
yeah,
It passed fully. It went all the way through. It's
it
supposed
did,
to.
but
It's
it hasn't, I know that it has not gone into effect, but I
correct.
think,
It's not being implemented at all.
yeah, but I know that the staff that, the labor delivery staff, as well as the residents and the interns that work in that environment, really work hard and trying to make sure that those families spend more time with their infants, so that there are those that are going to prison, so they won't have the time. There are those that are just not sure what their fate is, so they try to do their best to give them that kind of time. And hopefully, and there are always ways that they can work around um, setting things in motion so that they can spend more time. So that it does happen in that environment.
Something else that comes up for us that I just am curious about in this moment is
Mhm.
do babies more commonly go with family members, or do they more commonly go through the foster care system?
Family and friends mostly. There are some, where you have some individuals who really don't have family, like came through the foster care system and did not have the comfort of even being connected to a foster care family that they continue to have relationships with. So sometimes some of our babies go to DCFS, but it doesn't happen that much. A lot of families do take their nieces, nephews, and some family friends as well.
Yeah. Yeah, and that's a way that we have continued to think about this, especially we were going to talk about this a little later in the call, but we've shifted the name from Criminal Justice Core Team to Criminal Justice Impacted Core Team so
Okay.
that we can really think about this as folks who are also just impacted in some way.
Hmm.
Perhaps they're
Hmm.
partnered with someone who is
Exactly.
incarcerated. Perhaps there's a father in that equation who will now be taking care of the baby. And we have some fatherhood programs here in the IE who are thinking about that as well. So
Hmm.
really great to hear kind of some of what you all are seeing and
Hmm.
continue to think about this as a family issue.
Hmm. Yeah, and we changed, and when we first started in the very, very beginning, we focused only on those that were incarcerated, not necessarily anything outside of that parameter. But as we began to work in that space, and also as we began to realize that one of our biggest issues is retention when they leave, because a lot of them don't want to have anything to do with anything connected to any kind of incarceration. So they don't look at us as people that provide them with services and support. They look at us as people that are also a part of the incarcerated space. So that sometimes can be a challenge, but we do our best to connect to them and tell them if you need us, if you call, we'll come and try our best to continue to support you. So we do have a lot of loss sometimes after they have left and gone on to other places, if they've gone to maternity homes or um, uh, out, what do you call it, inpatient, outpatient programs. They just kind of lose touch, and they say, we know that we really appreciate what you do, but we just don't want to be connected to that environment. So we get that, and what can we do other than do our best to support them as best we can? Our lactation services, we have teamed up with Breastfeed LA. Brenda Viara is our IBCOC, and we also work with Hannah Saliki, who is right now volunteering her time because our funding is at a standstill. We're waiting for it to be approved so that we could start it up. So we haven't stopped it, solely, but they're not as avidly able to come due to funding. And she provides, consultations, care plans, talking about pumping and milk supply concerns. And we've had a few of those. We have make sure that they have access to the supplies that they need, making sure that they're educated in how it works for them as persons who need the support when they want to pump, and make sure that their children get their milk. And it is all encouraged by our lactation professionals. That helps us with policy review and recommend what is necessary to make sure that we adhere to the reproductive laws as it pertains to lactation and protecting the system impacted individuals. And it's a pathway to making sure that the parent and the child are connected through the human milk that the mother is able to provide, and even during separation. And it matters for various reasons, but we know how important human milk is for infant health, and making sure that they stay healthy, that their immune systems are not compromised. It helps to improve the outcomes of lactating parents. It helps the parents to somewhat heal through that bond of fostering that milk to that child, as well as reducing the stress and supporting the recovery, to make sure that they keep their dignity. And, we want to make sure that it creates a lifetime of love and nourishment between the parent and the child. Next slide, please. So this was, we made it really short, so because I wasn't sure the time frame that we had, but we want you to know that this is all done through referral, and of course we are not. Our our money is funded, so no one pays for these services. They get these services for free, in a sense that they don't have to worry about making sure that someone, if they don't have the money, that someone is trying to pay for it. It is absolutely free for them. Those that are in custody or recently released from women's jail, or for those who have been released from within the 6 months from prison and need the support. We make sure that however the support is needed, we do our best to make sure that every justice impacted person is served countywide. And if you are interested, or anyone that you know in our county that is interested in needing the support, here I'll tell you how to register and to submit the inquiry for the eligibility through AIM-CFCI at th.lacounty.gov, and just making sure you have your name or the person's name, because it doesn't necessarily have to be you, but you might know someone and you've talked to them about it. And a phone number where we can reach them, their zip code, when they are due, and if they're incarcerated or previously incarcerated or currently incarcerated, and if there are other things that we need to know about them. Next slide. I want to thank you for your time and giving us the space to be able to share with you what we do here in LA County. And if there's any ways that we can support what you're trying to do in the space that you're serving, let us know and we can figure out how to do that.